Thank you, Dr. Subodh Vaishne, Mr. Shashidhar Kapoor, and Mrs. Preeti Tripathi. And I have been given the honors to speak on family doctors on the front line. Today is 1st of July. It commemorates the birth anniversary and the death anniversary of Dr. B.C. Roy, who's the father of Indian medicine. And it has been declared as 19th May was declared as the World Family Doctor Day. So why do we focus on the family physician as in the front line? So we know every doctor, and we think that seeing the Bollywood movies and the Hollywood movies that every doctor is a superhero in a white coat. है ना? सफ़ेद कोट में डॉक्टर भगवान है. And their selfless service to mankind deserves our sincere gratitude, though I'm patting my own back at the same time. So the theme of National Doctors Day in India started on 22 last year. And even the PM office has carried on that the family doctors on the front line highlights the contribution of the service and dedication of the doctors. So what did COVID as a pandemic give us? It gave us a lot of lessons, and we realized that we were not prepared. And all the research and groundbreaking research, scientific data came to us as novice, because we as experts, Dr. Subodh Vaishne, Dr. Skand, Dr. Ajay Goenka, all the heads of the institutes and even the government institutes, they realized that they were facing a pandemic which nobody knew anything about. And it was as we managed our patients to a certain extent very successful in the first phase, and we managed the vaccination program post-COVID in the first phase, that we realized that the doctors play a crucial role in maintaining overall healthcare system. And according to the reports, during the COVID phase, 80% of us were highly stressed, including our technician, nurses and our paramedical workers. And still they continued working, losing their sibling, their parents, their family members. I saw at ground level at Siddhanta Super Speciality, and also my other colleagues in various hospitals, we saw them working hard, very, very hard, and 12-hour duties in very uncomfortable clothes. We could not even send them to the toilet for the 12 hours. So it was a very painful experience. So I feel they all deserve an applause. Let's give them applause. Okay? So, and 40% were stressed due to the fear of the violence. If the patient recovered, everybody was very happy. But in the second phase, because the loss of infrastructure, oxygen cylinders, oxygen supply, the illegal use of medicines, it traumatized, because none of us really knew what we have to take. We were gulping down medicine prophylactically also in fear that we will get COVID. And because of that, many of us felt we were not real heroes. So phase 2 of COVID was very, very traumatic for most of us. We lost our siblings, we lost our parents, and many of our other doctor, paramedicals and nurses also lost their parents and so on. So what is a family physician? Do we need a family doctor? If you realize 30, 40, 50 years ago when we were small kids, we used to always go to the next door doctor. Though I am a doctor's daughter, but I know that the compounder would come to vaccinate it along with the gentleman. So that is why a family medicine medical specialty is within the primary care that provides continuing comprehensive health care for individuals across the families, across all ages, genders, diseases and parts of body. That means they will treat our grandparents, they'll treat our parents, they'll treat our children, they'll treat our grandchildren. And that is how a family physician was conceptualized many years ago. But today, we as doctors always want to further specialize ourselves. So we become MD/MS, then we think of doing DMs and MCH, and then also we want to do super specialty fellowships. And ophthalmology remains a little behind, being only ophthalmology and fellowships. So therefore, I'm taking over the role of the family physician at the moment. So the specialist, who's usually a primary care physician, was named a family physician. So they are also the ideal members and leaders of the healthcare system, partners of public health, because of comprehensive care of unselected patients with undifferentiated diagnosis, whose practice is not defined by diagnosis procedures but by human needs. Family physicians do not treat diseases, they take care of people and act as leaders in front line of health workers. Next. So what do we look as a patient in a family doctor? Somebody who treats you with respect, listens to your opinions and concerns, encourages you to ask questions, explains things in a way you understand. When we go to super specialty OPDs, and I faced that with one of my siblings, from 9 to 5 in the evening, a patient who was given an appointment at 9:30, we remained waiting for the doctor. The doctor never came, none of the staff ever came, and it's in one of the leading hospitals. So I feel if there was somebody to take care of, even a resident doctor, who would have solved, who would have admitted the patient, it would have been wonderful. So this is why a family physician comes in, and she was for a super specialty reference. Next please. So the function is that they listen to the patient, they order, perform, interpret, test to diagnose the condition, explain the results to you, monitor your progress and re-evaluate your treatment when necessary. So we know family physician and we know internist. Internist is used more in USA where they treat only adults, and a family physician will treat adults, adolescents and also children. Next. So in the developing country of like India, 50% population still want to seek informal healthcare providers like traditional healers and pharmacy owner. और ये मैंने बहुत सारी कैंप्स की हैं मध्य प्रदेश, राजस्थान और गुजरात में, और वहाँ पे जब हम डिस्ट्रिक्ट हॉस्पिटल्स में रहते थे 5 दिन और कैंप करते थे, तो हमें हमेशा दिखता था कि छोटा वाला जो घर है उसमें एक लंबी लाइन होती थी ट्राइबल्स और विलेजर्स की, और उसमें ये पता चलता था कि सर का जो लीडिंग सर्जन था उसका जो कंपाउंडर था वो उसके प्राइवेट पेशेंट्स थे, because he gave more time than the MS and MD doctor to the patient, and he earned more also, and he was a very popular figure in that district. So that is how it is. The tradition of family doctor is gradually declining in India because everybody wants to consult a super specialist or a specialist. And this is also that none of us want to actually practice only family medicine and write parchis as it is said. We all want to be super specialities as doctors. And we can conceptualize these changes that the Indian healthcare system faces into 2 entities, the healthcare supply challenge and the demand of healthcare. Many diseases and specialities have emerged in the last 3 decades, and therefore the role of family doctor has diminished. Because of this important missing link, we are seeing gaps in the healthcare delivery, and hence people have lost trust even in the specialty healthcare facilities. Nobody wants to go to a big white hospital. They prefer to see a local general practitioners unless it's an acute emergency. Next. So, what is a GP and what is an internist we've dealt with. Now GP, you know, even if in the States or in UK, if you as a doctor change your resident, you have to reapply for the license of the other state. Your patients, if they move from one to another area, they also apply to become members of that society and the GP practice. And in fact, they have history more than 50, 100 years ago, they have records of the great-grandparents also with the general physician, whoever is the general physician. Everything is recorded and tabulated, which I think our Indian system lacks. So, your family doctor can be a good referral center system. And if you had a headache, we won't see a neurologist. If you have retention of urine, you may need to see Dr. Saurav Jain. And that is how the whole thing goes. So, a family doctor is a good way of primary health care, so the system should be encouraged. It is not necessary only for the MBBS or MD doctor to be a family doctor. It can be allied sciences also which work, like Unani, Ayurveda and naturopathy, homeopathy. But if there is an acute emergency, the practitioner has to differentiate and immediately refer to the specific specialist. Then second thing I would like to tell you is this will bring out more epidemiological research and publication which will help in screening for diseases also and also for treatment management in future. Lastly, it will help in preventive health, especially of communicable diseases, whether it is malaria, dengue, typhoid, or it may be SARS-1, 2, or it may be influenza, or it may be Omicron, or COVID, and COVID-4 may be also coming. So that is the way we have to manage, and I think having a next slide please. The load on the tertiary health facilities, whether private or government, will reduce. If we have family medicine as a subject in MBBS, as a specialization is MD family medicine, I think the load on the super specialities, what do you say doctors? In every single stomachache does not require referral to Dr. Gaurav Kohli. A family physician can give you that you ate too much and take an antacid today, do fasting for 6 hours. That would help. Everything does not demand a laparoscopic or a laparotomy. So that is the way it is. Every pain in abdomen cannot be treated. Like every headache is not a brain tumor. It can be a spectacle error. It can be overuse of computer vision syndrome. All children faced during the COVID and are still facing. So that is how we have to manage. So that way we can let the specialist only do very specialized work. So the specialist doesn't get tired because they really need to use their skills to make the patient recover. Next please. So I would advise BIC and Dr. Subodh Vashne that we should have all this included in curriculum. Dr. Arvind Rai is not here. I spoke to him personally. So he said in many states in the MBBS curriculum it has been included. Diploma and fellowship have started in family medicine, but it has not been included in the MP medical education as yet. So we can put up from your side to the cabinet. So India is a rapidly increasing population. We need to have affordable quality healthcare to reach everybody, whether it is rural, urban slums. And it can be done only in a decentralized manner by having a department of family medicine and training of doctors and retraining them in attitude towards the patient as a general physician. And I think the National Health Mission is emerging. Ayushman Bharat is there. Private sector is also venturing into primary and community-based healthcare facilities. I think the best for the last 15 years from where I joined, and it's not, again not patting our backs, BMHRC did excellent work in going into the periphery of the gas victims and also the rest of Bhopal. So I think that was a very good system for us to add on to. And thank you for a patient listening. It's a bilingual, so next time I'll speak in Hindi if you all give me a chance. And the third time I think I'll speak in Gujarati. Okay? Thank you.